So the session commences. Listening, part B. Each load consists of 6 bullets. And these will boomerang. We are going to convert that one into reading. Then we'll analyze the answer. So we'll see how it goes. So crisscross pattern. It's not straight. It's not super straight. It's not even straight. It's crisscross. That means there will be twisters. Okay. Contradictions, connections, and many other things. We are going to learn those things. And based on that one, we'll find out how the answer we'll get. Right. Fine. So what you can do is, I'm giving you 1 minute or maximum 2 minutes. I want you to write all the problems that you face with part B. The problems that you're facing with part B. Write down your points. Print screen. No. Yeah. Write down the problems that you're facing with part B. Is it time factor or is it something else? What exactly is your problem, or what exactly are your problems? Yes. We are going to get into three parts, three stages. Yes. Right. What are the problems that you're facing? Okay. Write down your points. Most of the time, I end up in getting 4 on 6 correct. Yes, I want 6 on 6. Okay, good. Problem I face in mock test is because of the twists and turns you are mentioning. Shravanti, tricky questions. Yes. Questions are tricky. Absolutely correct. Saranga, cannot understand some conversations. Good. So these are some of the points. Others also can share your points. Yes. So what you can do is, yes, how well you are going to understand a given question is more important. You should try to study the question. You should try to study the question. Study this question and you will know what it is about. First I'll give you one. Okay. So it is listening part B, PPT. Yeah. Enable editing, file, save as. Listening. Okay. So there we are. This is the question here. So now what we are supposed to do is, you should know what is the word. Okay. Which one should we focus? What is the point that we have to consider? That is very, very important. Try to analyze that one and it will be very easy for you. So in the first part, see the red color is the general information, background information. We call it background information. Okay. It's the background information, right? This is the background information. This first one, layer number 1 is the background information. It is telling about what you are going to do, and in that audio which you are going to hear, who is going to do what, with whom, and when and where. This is called the background. So you hear, that means what you are going to do. You are going to hear a role play, an audio. You are going to hear an audio. You are going to hear an audio. And this audio, a nurse is briefing her colleague. A nurse is briefing her colleague about a patient. A nurse is briefing her colleague about a patient. That's it. So you can understand there that a nurse is briefing her colleague about a patient. Now, a nurse is briefing her colleague about a patient. Okay. So, who is talking? A nurse. With whom is he talking? A colleague. About whom? A patient. So, first of all, you have to understand these things. Okay. What are the things that you are going to study is more important than what you are doing. Don't do just blindly anything. Don't do anything blindly. Do with some standard sense. Okay. Right. Now let us see here. You hear. What you are going to do is you are going to hear something. Okay. You hear something. An audio. You hear an audio. Here there are two things. This is the first part. And this is the second part. So, you hear an audio. You hear an audio. You hear an audio. And in this audio, there are three persons. One is there is a nurse. One is there is a nurse. And second one is her colleague. And third one is there is a patient. So there are three people. A nurse, her colleague, and a patient. So a nurse is talking to her colleague about a patient. Okay. So she is briefing. She is giving briefing. She's giving a brief. Brief means a short, okay, regarding a patient. So a nurse is briefing her colleague about a patient. Now, normally, this briefing will happen when you are giving responsibility or handing over the responsibility to another person. Okay, or you are giving a job. Come on, take care of this person, like that. When you give briefing, a doctor will give briefing to the patient. An in-charge nurse will give briefing to her junior. Or an outgoing nurse will give a briefing to the incoming nurse during the time of change of duties. So this may be anything in that matter. So you hear. What you're going to do? You're going to hear. So not everything is important. Something is important. And the background is a nurse is briefing her colleague about a patient. So this briefing, try to understand, briefing is the activity. This is the important activity. If this briefing is not there, then there is no meaning. This briefing is actually something very important information only. That means called summary, gist, summary or gist. So there are a lot of things. So you concise, you minimize, reduce, and bring only the quality things and get back to you. Only the important things will be there. So not everything you will tell. For example, you go to a movie and come back and give you a briefing to somebody who doesn't know about it. So you you will not tell the complete movie. Okay, you give a briefing of it, means gist, summary, concise story. So minimize everything. Unnecessary things are eliminated and only the most important things will come. So now that, if you see, she is the nurse warning her colleague. You can see here. And this is warning. So she is warning her colleague, the most important part. She is warning the colleague indirectly. Means take care of something. In that briefing, there is something which is very important, that is a warning. That is a warning. You should notice that. So about what? About what is she warning? About what is she warning? So now let us see the points here, how I am going to show you the track. The track goes like this. Okay. Okay. A nurse is the she, that means it is a lady. Her colleague, about. So these are matching. These are matching. In this briefing, there is some warning. Okay, this warning is about the patient because that is a problem. So there is a warning. So what is that problem? Now you try to understand what I am showing you there. So you can see the direction there. Okay, so you can see the direction there. Right. Nurse briefing her colleague about. Yeah. So fine. I'm giving a thin line. So this briefing is, in this briefing, there is a warning. There's a warning. This warning is about the patient because the patient has a problem. Right. And what is that problem? What is that problem? So question means problem only. Question means problem. So what is that problem? Warning about what? About allergy. Okay. About allergy or about falling. Okay. Right. Or you can say here is warning about some antibiotics. She is warning about falling. She is warning about a situation when he may be breathless. Okay. The first one is external, that is medication. The second one is physical, that means he is helpless, so he is falling. Third one is internal, that is breath. So first one is external, physical, and internal. So try to understand that. How you are dividing the words into three different things is more important. Right. If you consider very carefully there, okay. If you consider the things very carefully, there are three problems. One is antibiotics may be a problem. Second one is falling, ailing physical health or sickness. He cannot stand or he will fall down. That means his strength is not there. He doesn't have strength. So that's why he's fall. So falling is the problem. Second one is breathlessness. Third one is breathlessness. That is the problem. And these antibiotics are problem. So he may be allergic to some antibiotics. Next one, falling. He may be falling. That's why you should prevent from falling. Then breathlessness. So oxygen may be needed if he is breathless. So now you understand here, these are the connecting links. How you are going to connect. Okay, now let us see this one. So the first one is antibiotics. And the second one is falling. And the third one is breathlessness. So if antibiotics, some types of antibiotics are there, if he takes those antibiotics, he will get allergy. So allergy is the problem. He may fall, so you have to take preventive measures. He may become breathless, so oxygen should be given. So now you can see there. Okay, you can see there very clearly. So antibiotics are the problem. Okay, that is external. He's taking some antibiotics. And second on falling is physical health. So you have to prevent that one. Third one, breathlessness inside, internal problem. Okay. So then you have to give oxygen. Now, what should we focus on? So what are the things? I have given you many different things. Everything has a connection. Everything has a connection. Now, there is some commonality pattern. That commonality, I'm going to teach you all the rules because listening is a lot tougher than reading. Okay, I'm showing you those commonality factors. Okay. Now, first one is, this is patient. Okay, here it is the patient. Okay, and here is the patient. So that means patient is not important. You are eliminating that. You are eliminating that patient. You are eliminating that patient. So it is very important that you eliminate the patient. And remaining words. Okay, is a verb. To is a preposition. Of is a preposition. Okay, so they are not important. Be is a helping verb. To is a preposition. From is a preposition. So these are not important words. There are three words which are very, very important. What are they? Noun, adjective, and verb. Okay, next one. Be. Be is a helping verb. May is a modal. If is a conjunction. Okay. Now you see, allergic, more allergic, most allergic. That means it's an adjective. Antibiotics, antibiotics. Some, many. Antibiotics. Next one, prevent, verb, falling, verb. Falling is a noun also, from falling down. Okay. So next one, oxygen, noun, breathless. Okay, adjective. So nouns, verbs, and adjectives are very important. First important is noun, second important is adjective, third important is verb. These are the three things you have to take care of. Now let us see here. So now, after considering all these things, I'm going to give you some simple rule. What is there? So somebody is speaking to somebody about somebody. We normally know. The higher authority will speak to the lower authority or the lower. There are three ways of communication. One is upward communication, lateral communication, and downward communication. Three types of communications will be there. So now, this is a lateral communication. A nurse is briefing her colleague about a patient. And second thing is from known to unknown. Information will go from known to unknown. For example, you know information, you pass the information to that person who does not know the information. So known to unknown. You know the information, the other person does not know the information. So you will transfer the information to that person. So that is called transferring the information, right? To those people who do not know. So you can see all these things here. So the main thing is it's a briefing. So in a question, what you are supposed to do is always think about some negative word. Negative word. So negative word is warning. Sorry. Negative word is warning. So only one word is important here. Only one word is important. Then why did we are going all these things? Okay. It's a warning. Warning is related to what? Warning is related regarding, okay, negative word. Antibiotics are not negative. Allergy is negative. So focus on this negative word. And next one, care must be taken to prevent the patient from falling. Care is not negative, prevent is not negative, but falling is negative. So falling, so take this word. Oxygen is not negative, needed is not negative, breathless is negative. So this is the way how you have to identify what word you have to think about. And warning. So he's giving warning regarding what? Okay. Warning is regarding what? Warning may be regarding allergy. Warning may be regarding falling. A warning may be related to breathlessness. So these are the three words that you have to focus on. If you focus on these three words, yes, that is very clear now. So allergy will not be related to falling. Allergy will not be related to regarding breathless. So try to understand. So they are interdependent. They have, how they are interdependent with the warning. Warning we give only to the negative word. Remember that. Warning you will give only to the negative things. So when you give warning to the negative things, then it will be a very much suitable. So you have to see a question. Question normally is a problem. Problem means negative things. Negative things, here the word negative word is warning. Negative word is warning. This is the first type of thing. Then warning about allergy, warning about falling, warning about breathlessness. Allergy is reaction to something external. Falling is because of helplessness, personal, physical, and breathlessness is regarding is internal problem, right? So this is how, these are the four words which are very, very important. But now you have to keep these four words in mind. This is called scanning. This is called scanning. Okay. This is called scanning. When you scan these words, it is very easy. Now, warning. The same word may come or another word may come. Now I am giving you a chance to answer my question. What is my question? So you have, right? Okay. When I tell you the word, your first word, warn. Warn. Now this is the word warn. Now can you write the synonyms for the word warn? Synonyms. Synonyms for the word warn. Synonyms for the word warn. Write down the synonyms for the word warning. Okay, now write down the word synonyms, anything you want to say regarding allergy. Any related word. Any related word. Write down water. Next one, falling. Falling. Any hint. Breathless. Breathless. Any word, whichever you want to think, you can think. Activating your brain is more important. If it is wrong also, it's okay. Activating your brain is very important. Hello, Anita. Good evening. Yeah, sorry. So, now, very good. Yeah, care. Okay. So, allergic, falling, breathless. Any word related to falling, allergy, breathless, care. For all the three words, yeah, very good. There is one word somebody has written, vigilant. That's awesome. That's really awesome. Who is that one that has written this word? Sravanti. Very good. Very good. Omaketa. Admonish. Consider. Alert. Very good. Rajalakshmi. Suffocate. Yes. Notify. Negative response. Caution. Yeah. So these are some of the words. Now let us see. Listen very carefully. All these three things will be spoken. All these three things will be spoken. But you have to decide very carefully which is the right one and which is not the right one. Yeah, these are the three words. I'm putting them as they are. Okay. I'm going to place them as they are. Right. So, fine. There we are. Caution. Very good. Warn means caution. Very good. We got one word there. Right. Hide, floating, meeting, controls. Yeah. So this is the question. This is the question. Right. Where is this? Yeah, here it is. Part B.
Part B. In this part of the test, you'll hear 6 different extracts. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear 6 different extracts. In each extract, Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the...
So, you have listened to the audio. Don't write the answer until I tell you. So, question dash 25. Okay. Yes. When I tell you, that time only you have to submit the answer. Write and keep the answer ready and don't push the answer until I tell you. 7, 6, 5, 4, 3, 2, 1, and submit. You can submit your answers now. Yes. Come on, come on, come on. Yes. Okay, we have done that one. Now let us check our answer. Let us check our answer. Yeah. So we'll go to classical corrections, listening, part C, lecture. Listening, part C, lecture. Listening, part B, sorry, part B. Okay. Listening part B. Yes, this is now current one. This is reading. Listening part B. Reading again. Okay. Okay, fine. I'll do it now for you. Listening. Close this. Listening. Part B. Okay. So I'll give it to you now. No worry. Hide floating. So answer. I'm going to show you how you're going to take this. Print a screen. Question number 25. Yes, here you are. Yeah. This is boomerang 001. This is the first question from the first test. Okay, now what you are supposed to, sorry. Okay, function is changed. Okay. Yes, this is the question. Now I'm creating a poll for you. Okay, so this is right. Create a poll. A, B, and C. So quiz mode. Okay. Inductive. And deductive reasoning. Inductive and deductive reasoning. Okay. Now I'm going to give you the option there. So that's I'll hide the screen for you. Pause screen so that you will not see the answer which I'm giving you. So here it is. Yeah. So that's it. Yeah. So 25, question number 25. Question number 25. Yes. And the answer I have given there. And this is copy post link. So you can answer here. I'm giving you the link there. You click on that and you'll be taken directly to the quiz. Okay, there you can click A, B, C, whatever it is. And there is another link, that is, if you cannot access that link, this is the second link. So now 3 people have answered so far, and the rest have to resume share. So here you have to go there and you'll have A, B, C bubbles. So you can click on that one. Okay, click on the link and you'll know the answer. So 4 students have connected there. If you have no Telegram channel, you can download that and you can. Okay. Yeah. So 4 candidates. What about the rest? Huh? Sir is taking some pains and giving you the route and making planning for you. And still you don't want to just click on one bubble to know the answer. I don't know what it means. But still, even if half of the students are serious, it doesn't give me pain. Okay. So, right. So you can answer there. The links I have given you, you can answer there directly. So 20 students in all now. Very good. So 10 answers. That means 10 students are very good. Okay, I like it. So that's fine. At least 50% of the students have answered. Okay, we cannot expect quality from everyone. So that is their problem. So let us not bother about others. Okay. So those who are serious, try to learn them and try to implement them, because I am not going to give you the answer. I'm not going to give you the answer. I'm going to give you the solution itself. Okay, I'm going to explain. I'm going to give you the solution for that. So where is this? Where is this? Yeah. So 10 students have answered. 14 students. That's awesome. That's awesome. Responsibility increased. Very good. I like it. Now let us see. This is the solution. Okay, now what I'm doing is I am transforming this into another style. So this is B. 1, 2, and 3. Yeah. I'm transforming it into another style. Okay. Okay, fine. I told you I'm least bothered about anything. Quality is my fundamental prerogative. I don't mind if anybody is doing or anybody is not doing. But the thing is, those who are really serious, for those people, I am ready to do anything. That is what is more important for me. Right. So that's it. Okay. Now what is sir going to do here? Okay, because he's bringing out something different, totally different concept. Okay, a totally different concept, because you will never ever do this in your lifetime if Simon sir doesn't tell this one. You don't even know that such a thing exists, many of you, and you don't realize that because many times nobody will bring these things in front of you because it's a Herculean task. Okay, I don't mind to take this serious measures for your benefit. Okay, because you are my regular registered students. It is my duty to train you. So I'll take all the possible strain or stress or hard work, whatever it is for me. But I will leave no stone unturned. And I'll see that you'll get everything possible. Okay. Yeah. So 24. Yes, here it is. Here it is. Okay. Why should anybody bother about you, your result, your success? Nobody will bother. So, yeah, this is all the pains we have to take to make it easy for you. Okay, cooking a cake is a Herculean task. Your mother takes pains so that, okay, so that's it. Fine. So there you are. Okay. Fine. So what's odd here? Something is odd. Yeah. I'm sorry, just because this is the first time. Okay, earlier I have done, but I was not very much happy with that. So I'm making some changes because, yeah. Fine. 28. So let us check it out. 28. What does that say? So 18. Would that be fine? Yes, of course. Yeah. Yes. That is fine. That's fine. That's these are all the things because we work very hard and nobody, okay, steals our material. So that is why this precaution. Because I have seen my notes taken with great hard work and people simply take them and post them in their sites. It's okay. High float, yes. Now see here. You see here. Now, how the discussion goes is very important. How the discussion goes is very important. Right, now let us see. Okay, now here, this is the negative point is allergy, we have seen. And here falling is the negative point. Okay. Allergic and falling. Why are we going to these negative words? Do you know? Because the question is a warning. Warning is only in serious situation you'll warn. The only word is warn. This is the word that is going to help you out. So I have brought you and the listening comprehension, and I have made it into a reading comprehension. Okay. Yes. Now this is a warning. Allergy, falling, breathless. So that is how it goes. Now let us see the other way around. Yeah. Now, right. The same word will not, if you see from here, okay, if you see from the beginning, okay, allergies is here. Allergies is here. Just see what I'm telling you, that's all. She is at high risk for falls. Falls is here. Then antibiotics. Okay. Antibiotics is here. Antibiotics is here. We change her IV antibiotics to oral. Okay, fine. So now you can see very clearly there. Okay. Now if you see very clearly, allergy is related to this. Okay. Then falling is here. Allergy, antibiotics is here. And this antibiotics is here. Okay, fine. Then, and this false. Why is this false like this? Due to dizziness. Okay, the related words. Next one. Antibiotics, she is tolerating well. Okay. Next one. Assessment, normal. Assessment is normal, except for some mild shortness of breath and wheezing. Shortness of breath. Mild shortness of breath. It's not so serious that oxygen is needed. Shortness of breath is mild. Mild shortness of breath, not extreme shortness of breath. Only in the extreme conditions we give oxygen. So like that. Her vital signs are stable. Oxygen saturation is 98%. So she doesn't need any oxygen because oxygen saturation is 98% on 1 liter. And she's been comfortable during my shift. Okay, fine. Now let us see here. What is it talking about all these things? Okay. What is it talking about all these things? Now let us see. Number one is allergies. And she has no allergies. The patient is allergic to some types of antibiotics. She has no allergies. She has no allergies. She is on a regular diet and has no allergies. This allergy is related to diet. Try to understand, don't get confused. She's on a regular diet and has no allergies. So this is related to diet. This is related to diet, not related to antibiotics. Remember that. He's a little confused and twisted. She's on a regular diet and has no allergies related to diet because it's immediately. She has a high risk for falls. Falls. And she's at risk and this is high. Now you see, no allergies is negative, high risk is positive. Okay, so that is risk is more, allergies less. So no need to say give a warning for this. Allergies, no allergies. Okay, that is regarding diet. Okay, that's leave it because question is not related to that. So question is not at all related to that first allergies. Then she is at a high risk for falls due to her dizziness. Okay, she has the problem of dizziness. Okay, that's why she has high risk. So this is positive. Okay, she says positive. The next one, we change her IV antibiotics to oral, which she is tolerating well. So antibiotics is here. And there is nothing related to allergy here. Allergy is related to food there, food allergy. Okay, food allergy. But we changed her IV antibiotics to oral. Here only antibiotics came. So related to antibiotics, allergy is there. It should come after this, not before. So there is no reason that you connect that no allergies with that one. It's just for confusing you. We change her IV antibiotics to oral, which she is tolerating well. So that means she has no allergy for these things. Okay. And some types of antibiotics, nothing is given there. She has allergy to some types of information only is not given there. Okay. Information only is not given there. So she is tolerating well. Okay. Then her assessment is within normal except some mild shortness of breath. Mild. So shortness of breath is mild. Mild means very low. Now, this is 0%. Allergy is 0% here. Okay, but that is not related to the question at all because it is food allergies. And regarding allergies, regarding antibiotics, antibiotics is here. This information is not given. She is tolerating well. She is tolerating well because no allergies here. That's why she is able to tolerate well. Okay. So this is 0%. Warning is 0% here because there is no problem here. Then next one. She has high risk for falls. High risk. This is positive. High risk. Danger. Alarm bells. Okay. High risk for falls. High risk. Danger. So for danger you will warn. And that is related to falls. Okay. Then mild means very less. Maybe 20% of 10% or 5% or 25%. Mild. Moderate 50%. Moderate means 50%. Mild means very less, 20%. Okay. So that's no problem. So now let us see here. Okay. No. So allergy is here. Antibiotics and allergy. Antibiotics is here, but no allergy related to antibiotics. So this is ruled out. This is 0%. Information is not given. There are no some types of antibiotics. There are no which types of antibiotics. There is only IV to oral is given. Antibiotics. Okay. But nothing else. The next one. High risk. Risk means here. Warning you will give for a risk. And this risk, okay, is due to falls. Falling. Okay. Falling. The next one, mild shortness of breath. This is very shortness of breath. Breathless means shortness of breath. Breathlessness means shortness of breath. It is very mild. So why oxygen is needed if it is very mild? Mild means very less. So A is ruled out. B, C is ruled out. That is why falling is there. High risk is falling. This is 0%. Which one? Antibiotics. Information is not given to 0%. Mild shortness of breath 10%, 20%. Then high risk 80%. So 80% risk is there, then only warning. That is B. And B is the right answer. So you have to analyze the question like this. So not only listening, listening is also reading, reading is listening is reading without script. Listening is reading without script. They'll hide the script and okay, just read it out. And listening is without reading script. Listening is reading without script, and reading is yeah, listening with script. Okay, so that's it, nothing else. Okay, so that is the explanation given. That is the explanation given. So B is the right answer. Control Shift and print screen. Okay. So there's 18 students are given the answer. So you have got the explanation there. Now what I'm going to ask you one question here. So was the new style, maybe for you it is new style, okay, was the new style of understanding, okay, the listening comprehension beneficial? That means taking the script and analyzing the flow, because otherwise it is very difficult to explain. Was the new style of understanding the listening comprehension beneficial? So if it is right, okay, so you can say yes. If it is not beneficial, you can say no. Hit your button, 10 seconds time. So I'm going to give you a series of sessions. You can just hit the button yes if you agree with this point. If you say no if you do not agree with this point. Yeah. Thank you very much for your feedback. Okay. Abir, Dinni, Jivanti, Kausar, Meera, Oma, Rajalakshmi, Reena, Sai, Sindura, Sally, Dr. Sally, Sandamali, Saranga, Selvi, Smita, Sravanti, Yusuf. Everyone is regular student except one. You see, that is why only one student. Who is that? Prasanna Kumara. Okay. New student, welcome to the platform. Not everyone can enjoy the quality, because once you registered regular students, you don't want to miss the sessions. Others, they don't know what is going on here. So, right, we are least bothered about them. So next is the 26th question. Here, this is the 26th question. Right. So you have to understand, I did not give you any explanation anywhere. You have to do it on your, I'll just make you understand how to analyze the questions. Okay. Yeah. Right. Now let us see here. Now, you hear an audio. That is number one. So here separate. The manager talking to the nursing staff. the manager talking to the nursing staff. And this is a manager of a care home. And this care home is for the elderly. And this manager is talking to the nursing staff. So that's it. So the manager is talking and is the manager of a care home, and this care home is for the elderly. And this manager is talking to the nursing staff. Okay. And I told you always questions will be based on problems. So see that word, which is a problem here. Now I want you to be active. Now I want you to be active. What is the word? Earlier there was a previous word was warning. In the green zone. Green zone is in the middle, not in the red zone. Okay. Now what is the word? Okay. Which says problem. Come on, fast. What is the word which says problem? Okay. I'm giving you time. 10 seconds. 10 seconds. Yeah, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Submit. What is the word? Yes, very good, very good. Come on, fast. Okay. So I've given you 10 seconds, but still many people are not able to write. See? Huh? So is there anything else? Okay. So 3 people have written. One is, yeah, very good. Come on, activate your brains. Don't think about others. I'm counting from 10 to 1 means everyone should participate. Everyone should participate. If you do not participate now, how will you participate in the test? That's important. Right. Next. Now, very good. Now let us see. The word is errors. The word is errors. Now, errors related to dispensing medication to patients. Dispensing medication means giving medication to patients, usually result means, okay, effect, cause and effect. Cause and effect. Result means consequence. Consequence means effect. Effect means impact. Now here, there are 3 words. Errors. Errors related to what? Errors related to what? Okay. Errors regarding. Okay. So here also, failure. Failure is a negative word. Okay. Failure is a negative word. Okay. Administering drugs late, not early. Late is a negative word. Okay. The next one, interruptions is a negative word. Interruptions is a negative word. Errors. Yeah. Errors. You can see errors is an interruptions. What do you mean by interruption? Somebody come in between our work. I'm teaching something and somebody is talking. So that is interruption. Interruption, nobody will like. Okay, nobody will like interruption. So 2 people are talking and somebody comes in between and talks something else. We don't like. We say, why are you interrupting me? That means we don't like. It's negative. It's an error. It's a mistake. Okay. Failure. Success is positive, but failure is negative. Early is positive. Late is negative. Don't come late. Come early is okay. Late. So these are negative words you have to understand. Okay. Now coming to the point, interruptions regarding dosages. The point is dosage. How? Dosage means how much of medication. Allergies. Okay. And drugs. So is he talking about dosages or allergies or drugs? See how the words are separated. Okay. Now dosages, you are calculating the dosages, somebody disturbs, maybe you will make a problem. A failure to check for patients' allergies. A failure to check for patients' allergies. Now try to understand. Failure to check for patients' allergies. Now what do you mean by this point here? Failure, negative. You have to check, that's positive, but you fail to check, that's negative. Failure to check what allergies they have, like that. Administering drugs late in the day. Okay, drugs late administration. Late administration. You have to understand that one. Administering drugs late in the day. So now interruption. Now I want you to write the synonyms. Errors. Okay, what all synonyms you want to write, you can write. Interruption, then failure, late, okay, drugs, allergies, dosages, result, okay, medication, whatever you want to take any words and try to think of all the synonyms, okay, and write the synonyms. Come on, all the words related to this, okay. Error, dispensing, medication, result, interruptions, dosages, failure, allergies, calculating, measuring, this also is important. Check, okay, examine. So what are the words which you have to see? Okay, late, drugs, medication. So whatever you want to write the synonyms and write it in the chat box first. Yeah, disruptor, distraction, diverting, disturbance, results, outcomes. Very good, very good. These are some active students. Okay, these are some active students. What else words you want to write? You can write there. Mistake, disturbance. Very good. Yeah. Yes. Miscalculation, very good. Delay, very good. Misconception, very good. See, a lot of new words are coming. Unsuccessful, not successful. Very good. Delay, very good. Late means delay. Yeah, wonderful. Wonderful. Come on, come on. Yeah. Fault, fault. Very good. Yeah. Wrong. Right, fine. Okay. Now, let us see. Yeah. Right. Now, errors. Errors is regarding dosages, or errors regarding allergies, or errors regarding drugs. So what is it talking mainly about? Is it dosage or allergy? Dosages. Okay. Drugs. Allergies. Okay. These are the three things. Okay. Interruptions, failure, late, or all the errors. But errors regarding what? Interruptions is an error, failure is an error, late also is an error. But error regarding what? Error regarding dosages, error regarding allergies, error regarding drugs. Nouns are very important when nouns are there. So this is how you will go for the question. Right. Now, okay. Clear all drawings. Right. Now let me bring out the 4 important words. The 4 important words. First one is in here, errors. Only one word you take. Only one word. Errors regarding dosages. Errors regarding allergies. Errors regarding drugs. So that's it. Okay. So that's it. So this is the session. So get ready. Get ready for the audio now. Right. Hide floating meeting controls. Yeah. So these are the 4 words which will help you. Okay. Print screen. No function shift to print screen. Yeah. So this is the question. Boomerang. It is 002. That's it. Okay. Now, yes. Here is the question now. You have to listen and you have to answer. You have to listen and you have to answer.
Nursing staff.
Has an 18 gauge in her left arm.
Yep.
She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff.
1 minute.
Now
wait.
read the question.
Wait. 1 minute. Why should I extend